Hey guys, how are you doing, people? So today we'll be starting a very new topic of cardiology, that's myocardial infarction. So I have a question for you, and we'll solve it together. So if you are a medical student or a medical graduate who is preparing for USMLE or preparing for any other entrance examination, then my videos will be very helpful for you because I'll be touching every topic of medicine, and you'll get to know like what are the best strategies to solve question, and also like how concept based learnings is best for you. So let's start this question. So we have a 50-year-old man who presents to the emergency department 1 hour after the onset of severe substernal chest pain radiating to his left arm. The pain is accompanied by diaphoresis, nausea, and shortness of breath. His blood pressure is 155 by 90 millimeters of mercury, pulse is 80 per minute, and respiratory rate is 17 per minute. Which of the following tests is the most important tool in the initial evaluation of this patient? So what we have is a patient, 50-year-old man presents to the emergency department. So we'll read these options. First one is lactate dehydrogenase, LDH. Second option is aspartate aminotransferase. Third option is creatine kinase myocardial bound, CKMB. And the fourth one is echocardiogram, and fifth one is ECG. So let's do this question. So we have a 50-year-old male presents to the emergency department after 1 hour after the symptom of diaphoresis, nausea, and shortness of breath. Okay, and he also has chest pain. So the chest pain is the main complaint. Chest pain that is radiating to his left arm. Okay, so this is a very typical presentation of cardiac issue, means myocardial infarction. So myocardial infarction is basically a disease or like a presentation in which the blood supply to heart decreases. So why it decreases is because like the blood vessel that is that are supplying to the heart, they kind of gets narrowed or thrombosed, and supply decreases. So in that scenario, like the heart gets low oxygen and nutrients. That leads to ischemia, and ischemia presents as pain. So this is basically a classical presentation of myocardial infarction. So we have a myocardial infarction in this patient. So this question is asking us which of the following tests is the most important tool in the initial evaluation of this patient. Okay, so first we'll go to lactate dehydrogenase. So why lactate dehydrogenase, or why not? So lactate dehydrogenase is the test which is usually the diagnostic test for MI, but what other things we can see is this question has asked the most important tool, the initial evaluation. So why this lactate dehydrogenase is a correct answer or incorrect answer, we'll see. So lactate dehydrogenase is basically of two types, that is LDH1 and LDH2. So LDH1 is basically that's actually from heart tissues, and LDH2 is from endothelial system. So whenever we have a myocardial infarction or ischemia, that time LDH1 increased LDH1. So if LDH1 increases, and it actually increases, the time level of this test increases is around 12 to the time at which this test increases is around 12 to 14 hours. So the person came to us with the complaint at 1 hour. So 1 hour we won't be seeing any LDH increase. So this is not a correct answer. Let's see aspartate aminotransferase. So aspartate aminotransferase is a non-specific protein that is found in the cardiac and liver tissues and even muscle cells. And it usually, whenever we have a myocardial infarction, it kind of increases around 2 to 3 days post MI. So in cardiac tissues, muscle tissues, It means skeletal muscle tissues, and also it is also in liver, because we in our liver test we also mentioned this aspartate aminotransferase. So it kind of increases after 2 days post MI. So we'll be seeing this level increasing after 2 days. So this is not all, this is also not an option, because this person is coming at 1 hour. 1 hour duration means like initially how can we see the person has a myocardial infarction. Third option we have is CKMBs, creatine kinase myocardial bound. So why creatine kinase is a good option for us or not? Let's see. It takes around 4 to 6 hours to become detectable. So in the initial phase, like this person came within 1 hour. So in that initial phase, we won't be seeing this enzyme going up. So this is not a good option for us. And now we have echocardiogram. So why echocardiogram? So echocardiogram is basically the structural scan. So structural scan of heart means like we can see the structure, chambers of the heart. We can see chambers, we can see valves, we can see even pericardium, and the motion of the heart. But initially in the echocardiogram we cannot see any changes. Initial states, maybe a little bit of changes, but not appreciable. So initially we don't do this test, because that's not a very good sensitive test for initial evaluation of person with MI. So we do it later on, because later on post MI we do it, because in the post MI phase heart develops infarction, and infarction means like there should be an edema and wall motion changes. So we can see echocardiogram as a very good diagnostic tool for pericarditis or like effusion, pericardial effusion. So effusion we can see effusion, and scar, and wall motion changes and edema we can see, but that's like after a week or like after 4 or 5 days. We actually evaluate people with like with the history of MI with echocardiogram. The fifth option is ECG. So now we have only one option that is left, ECG. So ECG is the correct answer because we have already ruled out everything. So ECG is the initial evaluation test. So initial. Why? Because in the initial phase, the electrical activity changes. So let's see like how electrical activities changes. So electrical activities means like how heart changes is like initially we have this way, P, Q, R, S, and then isoelectric line, and then T. So this is P, Q, R, S, T. So in this phase, actually what happens is whenever our heart has some kind of ischemia, it presents in two ways: ST elevation, non-ST elevation. So ST elevation means like you're signifying that like the infarct or ischemia or infarct is transmural. Means like the whole wall of heart is involved. Means like if the vessel that is supplying this area of the heart, let's consider this as a chamber, then whole area got infarcted. So this transmural, like the whole wall got infarcted. Non-ST elevation means like ischemia is subendocardial. Means like consider this as a wall of heart. So this is the inner chamber. So only this part gets ischemia. This part, this is endocardium, and like the section below endocardium gets infarction. So this is non-ST elevation MI. So initially what we see is this section, either this section, I'll make this ST section, either it will go like this, like, or maybe this is ST elevation. or maybe it will go like this: P, Q, R, S. So like this. So this section goes down. This is ST depression. So now we come to the conclusion. If a person comes in the initial stages with the chest pain, chest pain, nausea, and like chest pain radiating to the arm, we suspect myocardial infarction or myocardial ischemia, and the initial test should be ECG. And then we can also check other things like, so we saw that like initially, if you have the first encounter with the patient, so then what we do is first do EKG of the person, ECG, and the second is do the troponin I. So if you see any detection, any high level of troponin, or seeing any ST elevation or ST depression in EKG, just you can confirm this as myocardial infarction, because these two tests, they define myocardial infarction, like the person has some kind of ischemia in the heart tissue. This is a very good graph depicting like how cardiac markers increases or decreases with time. So on the initial stage, like 0 hours, your myoglobin tends to increase along with your troponin I. So troponin I, you can see this dotted line, it increases. So troponin I is the initial evaluatory test and myoglobin, but it is feasible to do troponin I. So we do troponin I, and then is CKMB. So creatine kinase CKMB is the second test that increases around 2 days, then LDH. So LDH increases around 3 to 6 days and it stays pretty long. So this is the question. We have solved this question. Thank you.